The decision's been made to give this large contract for the procurement of drugs to a company that really shouldn't have been allowed to bid in the first place. At the last minute, the rules governing the procurement procedure were changed to allow companies that didn't have international certification to take part. And this company that's been awarded the contract is one that doesn't have international certification and one that put in a relatively expensive bid. So it's clearly a very suspect procurement process. PNG's had problems in the past with the counterfeit or fake drugs and with the distribution of those drugs. And this sort of decision is just going to ensure that those problems continue into the future.
You mentioned there have been previous instances of corruption and questions over how funding has been handled in Papua New Guinea's health system. Should Australia have maintained previous quality control criteria conditions on the funding that was given in the first place?
Yeah, I think that's a very good question, and it's important to understand the background to this case. PNG has had these problems in the past, and recognising that in 2011, so just 2 years ago, the Australian government offered to the PNG government that as part of its aid program, it would take responsibility for both the procurement of basic medical drugs and then the distribution of those drugs to PNG's health clinics. The PNG government agreed to that, and that was a very welcome initiative by the Australian government. But in fact, we wrote at the time, back in 2011, that there was no point doing this just as a one-off, that if we were going to take this responsibility, we had to do it for many years to give PNG the time to sort out the problems it has in the area of drug procurement. But unfortunately, and really inexplicably, that agreement was very short-lived, and last year we agreed to hand back responsibility for drug procurement to the PNG government. But not to give it fully back, we also agreed that we will provide some support and have some oversight in what was called a delegated procurement arrangement. But obviously that procurement arrangement hasn't worked because it's delivered this very unfortunate outcome. And so I think a lot of questions have to be asked, not only the PNG government, but also the Australian government. Why did we agree to hand back procurement responsibility to the PNG government, given that we documented ourselves the profound problems with PNG drug procurement systems, and then secondly, to the extent that we did retain some involvement and provide some support, well, how did this outcome eventuate?
Given that Australia also has considerations in terms of our asylum seeker processing on Manus Island, is there a concern that those sorts of considerations will affect any future resolution of this particular issue in Papua New Guinea?
I think that is a serious risk. It's good that now the Foreign Minister has confirmed that we are withdrawing that funding, and that was an appropriate decision because we couldn't support such a poor policy outcome and a decision that, as our Foreign Minister said, will put people's lives at risk. So it's good that we've withdrawn the funding, but in fact that decision was made several weeks ago, and it's only become public now because it's got the attention of the media. And so it does seem that we're taking a very softly approach to this. The issue wasn't raised, or at least didn't feature in the communique of the PNG Australia Annual Ministerial Forum, which was just a couple of weeks ago. And you'd think for such an important issue that would be front and centre of such a meeting. So you do get the impression that we're taking a softly approach. We need PNG to take our asylum seekers who arrive by boat, and there are now some thousands of these to go onto Manus Island. And so clearly, we don't want to antagonise them. But I think that is unfortunate because we have a very large aid program in PNG, and it is going to require tough decisions and a tough dialogue, and I think we should be calling preferably for a joint investigation into what went wrong with this procurement process.